Are you at risk for prediabetes? We've all heard of diabetes. But did you know there is a disease called prediabetes? With prediabetes, blood glucose, also known as blood sugar levels, are higher than they should be, but not high enough to be diagnosed as diabetes. This is when you may be diagnosed with prediabetes. A1C is your average blood sugar during the past 3 months. Prediabetes is when your A1C is between 5.7% and 6.4%. Having prediabetes puts you at a greater risk for type 2 diabetes and heart disease. Insulin is a hormone released by the pancreas that plays an important role in how your body processes food. Type 2 diabetes can develop when there isn't enough insulin or the body's cells resist the insulin. This is called insulin resistance. When you eat, your body changes the food into a sugar called glucose. Glucose stays in your blood until insulin moves it out and into your cells to use as energy. When insulin resistance occurs, your pancreas produces more and more insulin to help the glucose enter your cells, until eventually the pancreas can't keep up with the higher amount of glucose in the bloodstream. With nowhere to go, glucose builds up in your blood. Having a high amount of glucose in your blood over time can lead to prediabetes blood sugar levels, which, if left untreated, can lead to type 2 diabetes blood sugar levels. Most people with type 2 diabetes have had prediabetes. In addition to higher than normal blood glucose levels, other factors can increase your chance of developing prediabetes. Many of these following factors are similar to those for type 2 diabetes. Being age 45 or older. After age 65, your chance for developing prediabetes rises significantly. Having a family history of prediabetes and diabetes. Being African American, Hispanic, Latino, American Indian, Asian American, or Pacific Islander. Having high blood pressure. Having low high-density lipoprotein, HDL, or good cholesterol. Having high low-density lipoprotein, LDL, or bad cholesterol. Or having high triglycerides. Being physically inactive. Without regular exercise, your weight can increase, and being overweight is a risk factor for prediabetes. Being overweight and having a body mass index greater than 25. Extra weight in your abdomen is particularly troublesome because this can cause insulin resistance. Having had gestational diabetes, diabetes during pregnancy, or having been diagnosed with polycystic ovary syndrome. This is a hormonal disorder that causes the ovaries to become enlarged and develop small cysts. Prediabetes is sometimes called either impaired glucose tolerance or impaired fasting glucose. Because there are no clear symptoms for prediabetes, you may not be aware that you have it. Some people with prediabetes feel some of the symptoms of diabetes, like being tired and weak. If you find yourself feeling tired or weak often, have your healthcare team test you for prediabetes. You may be given suggestions for lifestyle changes to help prevent or delay type 2 diabetes from developing. Some of the blood tests used to detect prediabetes include a fasting blood glucose test, which is done at least 8 hours after you eat to see how well your body has processed glucose. A blood glucose level of 100 to 125 milligrams per deciliter indicates prediabetes. An oral glucose tolerance test, which measures blood glucose 2 hours after you drink a special liquid containing glucose. With this test, a blood glucose level of 140 milligrams per deciliter to 199 milligrams per deciliter indicates prediabetes. An A1C test, which gauges your average blood glucose to see how well it's been controlled over the prior 3 months. An A1C of between 5.7% and 6.4% indicates prediabetes. If you're diagnosed with prediabetes, you'll want to be checked every 1 to 2 years to be sure your prediabetes has not progressed to type 2 diabetes. Seek treatment if you have any signs or symptoms of type 2 diabetes, including tiredness, weakness, increased thirst, blurred vision, and frequent urination. If you have prediabetes, you may need to change the way you eat, be more physically active, quit if you smoke, and see your healthcare team. You may also need to take diabetes medication. A treatment plan is important to your heart health, since prediabetes may increase your risk for heart disease. You may have diabetes and heart disease at the same time. It is important to have your cholesterol and blood pressure checked regularly. Getting treatment early on can return your blood glucose level to a normal range and will help you maintain it. The good news is that you can take steps right now to lower your chance of developing prediabetes. Losing weight, even a small amount, like 7% of your body weight, can go a long way toward reducing your risk of prediabetes. For example, if you weigh 200 pounds, losing just 10 to 15 pounds will help. It may also lower your blood pressure and cholesterol. Remember that slow and steady is the safest way to lose weight and keep it off, so strive for 1 to 2 pounds per week. Exercising regularly has been shown to prevent prediabetes, improve blood pressure, and lower fat in your blood. Experts recommend 30 minutes of physical activity 5 days a week. You can divide the 30 minutes into 10-minute sessions of moderate intensity activity, such as brisk walking. Talk to your healthcare provider about what types of exercise might be right for you. There are many other ways to incorporate physical activity into your daily routine. Try putting more energy into housework or yard work, or do activities you enjoy, such as dancing or going on active outings with friends and family. Eating a healthy, balanced diet containing less saturated fats and calories can decrease your risk of prediabetes. You can find information on calories, ingredients, fat percentages, and more listed on the nutrition labels of many prepackaged foods. Need help eating healthier? Try these tips. Add fruit to yogurt or cereal, and veggie toppings like spinach, broccoli, and peppers to sandwiches and salads. Choose brown rice made from whole grains instead of white rice that is processed and has fewer nutrients. Select healthy snacks like fruit, nuts, or popcorn. Use spices like garlic, onion, and paprika instead of salt to liven up the taste of food. Cook with less oil and butter. Broil or bake with non-stick cooking spray or low-salt broth. Instead of fries, substitute a salad with dressing on the side. As a reminder, the risks of prediabetes and type 2 diabetes include being older than 45, having a family history of diabetes, being overweight, being Latino, Hispanic, or African American, having high blood pressure, having low high-density lipoprotein, HDL, or good cholesterol, having high low-density lipoprotein, LDL, or bad cholesterol, or having high triglycerides, being physically inactive, having had gestational diabetes, diabetes during pregnancy, having been diagnosed with polycystic ovary syndrome. While there are no clear symptoms of prediabetes, you may feel tired and weak. Some other signs and symptoms of type 2 diabetes may include increased thirst, blurred vision, and frequent urination. Please discuss with your healthcare provider if any of the risks or signs and symptoms reviewed in this video are familiar or concerning to you.